I am in our house today. We're about to take the wrappings off of my ACL surgery that happened. The wrappings have to stay on for 5 days after the surgery. So now we're going to go ahead and take them off. For those who haven't known, I had to have an ACL surgery, a whole reconstructive surgery on my knee, meniscus, all that kind of stuff. I tore it a long time ago in a volleyball accident and then just skimped around on it for several years due to lack of money, lack of good insurance, downtime. Now it's a good time in my life, both financially, insurance-wise, even relationship-wise, because I have an awesome wife who can take care of me. Because of all that is why I chose to go ahead and do it now, and let's see the results. So again, I haven't taken the wrappings off since the operation on Wednesday, so I have no idea what it looks like. I'm sure for those athletes out there that has injuries and surgeries all the time, they know exactly what to expect and what to look like. But for regular Joes such as myself, this will be my first operation. So I don't know what the incisions are gonna look like and how bruised it's gonna be and such. Hopefully it won't scare me. But the big reveal, let's see what's gonna happen here. Ooh.
Staples.
Okay. So this is what we see. This is not bruising. This is the pin they mark so they know what knee to operate on. This is honestly a little gnarlier than I expected. It's more swollen than I honestly expected it to be because it feels relatively good, but that kneecap is still so swollen after all these days and anti-inflammatories that I have been taking. Interesting that they use staples instead of stitches. I definitely expected a stitch, but I kind of am digging the staple of how secure that is just to squish that skin together so it can refuse. It's pretty talented how they could do such an extreme surgery because again, a lot needed to be done to the knee. I will probably have Elena attach some pictures of some of the operating fix that they gave me. They had to do a lot. The knee was pretty messed up and they had to clean it up a lot. Of course, do the ACL reconstruction, cut away the meniscus. So they had a lot to do and they only made, what, 3? They made 3 incisions in my leg from doing all that work, and they're not very long. They're about 1 inch long. This one is definitely the longest, and then they have a little one and a little one. It's pretty awesome. I appreciate the surgeon. I appreciate University Surgery Center in Merced where I got it done, and more so, of course, the surgeon, Dr. Vanek. I found him on YouTube years ago. Funny story. I found him on YouTube years ago, and I saved his contact info because he was talking about all this cool advanced reconstructive surgeries that he does for knees. So I put his contact info in my phone. Like 4 or 5 years later, he ends up being the surgeon once I have awesome insurance. Again, shout out to Anthem Blue Cross because they have been so great. Since I knew this operation was going to happen, I got their best plan. Then I got the surgeon of my choice, and then I made it happen. It's doing really good. I could sleep on my side for the first time last night, even though I probably shouldn't. I'm still doing ice though. It's feeling pretty good. Again, it looks a hair more swollen than I expected it, but other than that, it looks good. So this morning when I was using the restroom, I felt something trickling down my leg that, no, not that, but it felt like blood or something, and Elena pointed out that this part of my staple has fresh red blood. So unfortunately, I think I must have somehow stretched that part of the staple and made it to bleed, so that's not the best. Hey, next day after you've seen me unwrap the ACL surgery, I'm now showered. I shaved my whiskers. I feel much better. I got a little bit better sleep, and today Elena made a bomb breakfast that we had outside. It's pretty pretty out there today. A nice 80-degree California day in November, so we got to enjoy that this morning. She made a bomb pumpkin spice caramel coffee for us this morning. That was probably the best coffee I ever had. She's grabbing some pictures of her succulents right now. Helena, go show them your succulents.
Here's the little setup that Matt made. He built both of these. Awesome succulent planters. This one holds all these boxes. I've got all my little babies in it.
It feels good just to be able to get up and move around because you start hurting just laying in bed. So it feels good to crutch downstairs and have breakfast, or just roll around in bed and change the position, which I can do more now with my knee because it's getting less painful and less stiff, which is nice. Something about surgery that's not really talked about a lot. The pain of laying down and not being able to move or be very mobile. So nice to get up and stretch and move about. The other thing is I'm having this weird, like, super sore calf. It's like I did the most extreme calf day you could imagine, and with a really, like, sore open wound spot that doesn't make any sense. It feels like an open wound. It's actually not one. It feels much better today after trying to work out some of those sore spots. Sore calf that I'm talking about is on the surgery leg, so I don't know what is causing the extreme calf pain, but hopefully that'll be behind me, because right now that calf pain is hurting way worse than the surgery. Pain relief. When dealing with an injury of any sort or a surgery, you're going to be prescribed pain medication. Usually that's going to be some sort of opioid, like the one pictured just now. Opioids inhabit the place where the little pain signals would latch onto the receptors, thus decreasing your pain. Plus, they can, of course, create their own feelings and sensations of airheadiness, which I would like to call it. When I was on them at the beginning of my surgery, I felt just kind of airheady and kind of off. And then we have acetaminophen, which is another pain blocker. It's not going to actually help swelling or inflammation. It's going to block the pain receptors. And it's very liver toxic, may I add. And then we are going to have an NSAID. The non-steroid anti-inflammatories are going to actually reduce inflammation and swelling, and they thin the blood, and they have a lot of other health benefits. You don't want to take these before surgery, of course, so I had to make sure I did not take a little bit of aspirin each night, which is good for your health before surgery to thin the blood, so I would clot properly. If you're looking for the best, in my opinion, way to handle an injury or pain, definitely I'd recommend an NSAID over the other two. The other two is more just if you are in a lot amount of pain, just block those receptors and feel better. I googled it and it said that I knew your leg had to be raised to decrease swelling, but I didn't know how high. So I googled it and it said like 15 inches. That's pretty freaking high. So as you can see, I have my leg piled up pretty high on pillows with some ice packs around it. It's pretty uncomfortable today because of that lowest lawn laceration in the knee that they opened up that hasn't fully sealed back together yet. Because of that, I have it in the brace right now because it was most comfortable being braced up. I actually haven't used the brace that much though, because early on, especially with the swelling, just was not comfortable.